Hey everybody, it's Dr. Jake Hollingsworth again. Just wanted to have a little bit of a conversation about a topic that seems to be coming up a lot, and I don't have anything really prepared for it, so I'll just talk kind of like off the cuff about this topic. It's about the differences between intramuscular and intravenous ketamine infusions for mental health treatment. So at our clinic, we offer both. We do IV infusions. It's a zero point 0.5 milligram to zero point 0.8 uh, milligram per kilogram dose over 40 minutes. We also do an intramuscular dose that's basically the same dosing. We start a little lower for the intramuscular than we do for the IV. In the beginning, our clinic started out like most clinics back in that time frame, 2015, 2016, and we were doing only IV infusions and still was somewhat of a range of dosing. Mostly it started at zero point 0.5 milligrams per kilogram, which is what all the clinical trials, most of the clinical trials were based on at that time. Um, Over time, we did a few intramuscular treatments. It was mostly done as an alternative. Occasionally, somebody has difficult IVs. Maybe they prefer not having an IV started, so we would do intramuscular injections. I don't about maybe early this year, late last year, we decided to start doing more intramuscular treatments because we found that there was some research that studied both methods, IV versus IM, and a lot of clinics were doing only IM, and we started to think, why are they having good results? Can we do that? Is it a good option? What's the differences between the two? So we took a bit of a deep dive into it based on some of our experience, and I talked to a lot of people that were doing intramuscular treatments only, and it turns out it seemed like a good idea to offer both treatments for a variety of reasons. One, I'll just kind of break it down simple, the way that I would break it down to a patient that I'm seeing that's considering ketamine. So this is a conversation that I've had many times over the last year, and it's been going pretty well so far. I would say we've done, close to 6,000 treatments at our clinic up to this point, and probably, over the last year, it's been maybe more like 80% new patients do intramuscular over IV, whereas before it was more like 90% or more were doing IV. I'll try not to ramble too much, but the basics are, one, it's a cheaper treatment. So it requires a person with IV skills, it requires IV supplies, it requires some way to administer the treatment, whether it's an infusion pump, which have to be maintained. So there's significant cost involved in doing the IV treatments. So it's at our clinic, it's a little less than $200 difference between the two treatments. So that's definitely a factual difference. There's a price difference. And if you look around to the community, there's IM clinics. They're usually somewhere around that price point, and same with the IV. There's some variation. Some of the clinics charge. There's a clinic local in town that I think charges $1,000 an infusion, and there's another clinic in town they charge about $400 for an intramuscular injection. So there's a pricing difference. The other big difference is there's a difference in how the treatment is experienced. So the infusion is 40 minutes. It's calculated out. It's very precise. There's a start point and an end point. It takes about 5 minutes to reach that peak effect that is plateaued and maintains for about 30 more minutes. So it's a much more gradual process. And at any point during that 40 minutes, the treatment can be stopped. So if somebody's not tolerating it well for whatever reason, we can stop that. And the recovery begins soon after, and it gets people out of that point in the treatment where they're not really tolerating it really well, whether it's nausea or anxiety. The intramuscular treatment, it's administered one single injection into usually the shoulder muscle, always the shoulder muscle, one of the sides. It's a little bit of a shorter duration of treatment if you go dose for dose. So it's maybe around 30 minutes before you're in kind of recovery mode and you're kind of out of the thick of the ketamine effect. We start a little bit lower with the dosing because because it's a much more dynamic effect. So as soon as the injection is given, within a minute, that effect really takes off. So you're really got to strap in for that ride to the peak of the ketamine treatment. A lot of people tolerate it just fine. Some people really find it they like it. And then there's some people that really don't like it. It's a little bit too intense for them. And for those people, the IV infusions are probably a better method to go. Some people say, oh, there's not an off switch. If I don't like it, there's no way to turn it off. Well, you don't really need to turn it off. Your body is basically turning it off as it's being absorbed and metabolized. So by the time you start, reaching some of that anxiety point or the nausea, it's going to pass naturally because the body's already breaking it down. So there's a definite increase. So I would say a much more constant effect with the infusion, much more dynamic with the injection. Side effects are very similar. It's nausea, vomiting. It's a low incidence of vomiting, but sometimes people feel a little queasy. Anxiety can be a problem either way, and blood pressure can be an issue too. Those are the most common things that we deal with ketamine treatments. And they're both very similar with both methods. Does one work better than the other? That's one of the other big questions that I get. In my opinion and in my experience, there is no difference whatsoever between ketamine infusions and ketamine injections. That's just my opinion. If you ask 10 other ketamine providers, they're going to give you probably 10 different reasons, 10 different answers. You got to kind of take each person, figure out where they're coming from. If they're an infusion clinic, they're going to tell you the infusions are better. If they're an injection clinic, they're going to say the same thing. What's the point of paying an extra $300 per a treatment when they both work the same? So I think at our clinic, because we give both, we can give you a better unbiased opinion. Whether that's right or wrong, that's up to, maybe something that's debatable. But I stick by what I see. I've done, I would say hundreds, if not close to 1,000. I don't know the exact number. I could probably pull it up. But we've done a lot of injections over the last year, and we've done a lot of infusions over the last 5+ years. So my opinion, it's not, one's not better than the other. They're going to feel different. Some people don't like, so some of the reasons that might make somebody decide to do one over the other. Some people don't like getting IV catheters. Well, for you, that's injections may be better. Some people don't like the thought of it being an intense ride to the peak of a ketamine experience. Then for those people, maybe infusions are better. If it's a dollars amount, if it's a financial issue, well, then people are going to tend to go more for the injections, because ketamine is not just a one and done treatment. It's probably going to require some amount of treatments over some amount of time. So you're talking not just one treatment. If that was the case, who cares? Do the IV if you feel like that's better. But if it works for you and you're going to maintain it regularly, maybe it's going to be 10 or 12 infusions or treatments a year. So that times the difference in price, that's a big chunk of money. That could be thousands of dollars difference that you're saving. It only makes sense to me to be able to offer both modalities. I really strongly believe that ketamine is a very effective treatment for a lot of people with depression and even anxiety disorders as well. And not to offer both of these. I'm just glad that we're in a position that we can offer both. If I could only offer injections, I would do that. It just turns out that we have a model that's based on an infusion treatment. So that's why I'm glad we do what we do. So those are some of the differences between those. I know it's kind of a long, rambling, unorganized little talk about it, but I'm happy to answer any of those questions, either during a consultation, obviously, or if people want to drop some comments and questions into the into the posting, feel free to do that, and I can bring this up again and we can hit this again, or maybe at some point, if I see something popping up a lot, maybe we can do a little bit of I can answer some questions about the differences in the treatments. And we're going to cover lots more different topics over time. I just figured this is one that every day I get asked, which is, I would ask it too. If somebody says, hey, I do ketamine and I do IV and IM, well, everybody wants to know which one they should do. Sometimes it's an easy answer. Sometimes people go back and forth. And the good thing at our clinic, you can go back and forth. You can try one if it really feels like it's off, or it's too rough, or you feel like you want to use the more researched, evidence-based modality. You can do that. So that's the beauty of our clinic, is we have both right at our fingertips. And for my patients, they can decide last minute to go, oh, let me do the injection. It's an easy thing. I just draw the medicine up in a different syringe, or I put it into an infusion pump. It doesn't really matter. All of our treatments are done in the same rooms, the same time frame, the same supervision, the same, the doctor, my wife and myself are the doctors that administer all the ketamine treatment. So it's not going to change anything except for those differences, how it's experienced, and really the price. Those are the two biggest things. So that being said, I'm going to kind of call it. It's 10 minutes, good enough. But anyways, feel free to drop some comments and questions into the the posting, and we'll address them. Otherwise, I'm going to sign off and probably give another little I don't know what you want to call this thing in another week or so. We'll see what comes up over the next week, and if I'm seeing a lot of stuff, or if I'm getting comments or questions on the post, or I'm seeing it a lot in the clinic, I'll bring those up. But hopefully we'll get to start talking about some psychedelics and some of those things, which is really a cool topic. But so far we'll just talk about ketamine, because it's something that I do every single day, 5 days a week, and I can talk all day on these topics. I'll try not to be too boring. But anyways, hope this is helpful. I'm going to sign off, and take care of yourselves.